good afternoon. I'm Janet Schindler, the Monmouth County Coordinator for the SHIP, that's the State Health Insurance Assistance Program. I wanted to thank the Long Branch Public Library for hosting this presentation this afternoon. And let's get started. So what is SHIP? We're local help for people with Medicare. We provide free, confidential, unbiased information for Medicare beneficiaries, their families, and caregivers regarding Medicare and related health insurance benefits. So we don't sell you anything. We're here to provide you with information and education. A lot of you will be receiving lots and lots of mail as you're turning 65, and for those of you who already have Medicare, lots and lots of communication, TV, and so forth with regard to open enrollment. Just know that we're a trusted source of information, and we're not trying to sell you anything, just help you pick the plans that are best suited to your needs. So we're going to start with an overview of Medicare. It's a government-sponsored health insurance for three groups: those who are age 65 and older, if you're under age 65 and receiving Social Security disability for more than 24 months, or if you have a diagnosis of end-stage renal disease or ALS. It's administered by the federal government and the Centers for Medicare and Medicaid Services. And you enroll in Medicare through the Social Security Administration, or if you worked for the railroad, through the Railroad Retirement Board. 64.1 million people are currently enrolled nationwide. So Medicare has 4 parts. They love the alphabet. We have Part A is hospital insurance. Part B is your medical insurance. That would be kind of anything you do on an outpatient basis, your primary care doctor, lab work, scans, all those kinds of things. Outpatient surgery centers are very popular now. Part C is Medicare Advantage, like HMOs and PPOs, which you may be familiar with if you're still working, and the kind of coverage you have there. And then Part D is the Medicare prescription drug coverage. Parts A and B are usually referred to as original Medicare or traditional Medicare. And parts C and D are optional. You don't have to have them, but if you do not take Medicare Part D or a Part C plan that includes drug coverage, you will end up having to pay penalties. So we'll go over that in more detail. So each part of Medicare has different rules for enrollment. They have different monthly premiums, deductibles, and cost sharing for services, which could either be co-insurance, which is a percentage of the cost of your services, or copay, which is a fixed amount. So enrolling in Medicare Part A and B. We already noted that it's done through Social Security. If you are already getting Social Security retirement benefits when you turn age 65, you will be automatically enrolled. So if you're getting SSD, the disability payment, you would be automatically enrolled. If you signed up to get Social Security benefits at 62, which is the earliest age that you can do that, you would also be automatically enrolled. You must opt out if you don't want to be enrolled because you have other employer-based insurance. So if you get a card from Medicare that says, you're automatically enrolled in parts A and B, and you want to disenroll from either part of that, either the Part A or the Part B or both, that card will tell you how to do that. Okay, your initial enrollment period. So when can you enroll? 7-month period. It starts 3 months before the month of your eligibility. It includes the month you turn 65 and for 3 months after the month that you turn 65. So we get a lot of calls from folks who are maybe even a little bit earlier in that window because they're, they know that it's coming and they want to get prepared, and so they contact us, and our counselors kind of give them the scoop, get them ready, so that when that the beginning of the 3-month period comes around, they kind of are prepared and know what kinds of choices and so forth that they want to make. But we also speak to a lot of people who call the month of their birthday, and we help them as well. So we have 10 volunteer counselors in Monmouth County, and we have started going back in person. So there are sites throughout the county where you can get in-person counseling services, and then we have a number of counselors who are still working over the phone.
How do people know to call you and not just trying to call Medicare directly? is there something on the info you get in the mail that directs you to your nearest SHIP counselors, or?
Okay. So the SHIP program for the state of New Jersey has been running some advertising. They've been sending some mail out. That provides the hotline number for the state of New Jersey. They would give you our number. If you run across any of our advertising, we just did a big postcard mailer for folks that would fall within the Medicare savings programs, which we'll get to. That'll have our telephone number on it, and any materials that you might pick up locally where we've tried to advertise our services will have our local number on it. But there's a couple ways, and if all you remember is SHIP and you Google that, you'll get the New Jersey number and they will help you find us.
So you pretty much would never call Medicare directly. You're always going to be referred to a SHIP.
They might give us our number as well.
Okay.
From Medicare, they have that information. So your general enrollment period. This is if you miss your 7-month period, there is an opportunity to enroll January 1 through March 31st each year. Coverage is effective the month following enrollment. So, say that say your birthday was in August, and you didn't enroll by, let's say that would be November, August, September, October, November. So you didn't enroll by the end of November. You would have the opportunity to enroll in January and have your coverage effective in February. But you wouldn't be able to enroll in December because you were outside your initial enrollment period, and we hadn't reached the general enrollment period yet. There is a premium for not being enrolled in Part B when you don't have other coverage. It's 10% for each 12-month period that you were eligible but not enrolled. So for the example that I just provided, there would not be a penalty because there was not a 12-month period in which you were not enrolled. But you would have that break in coverage because you would have that month of December in which you didn't. Well, actually, if you turned 65 in August, you would have had no coverage for September, October, November, and December. You pay that penalty for as long as you have Part B, with very limited exceptions. And then there are special enrollment periods when you have an opportunity to sign up for Part B without being subject to penalties. They're available to, if you're age 65, because you were working for an employer with 20 or more employees. So you're still working, you're still getting insurance through active employment. A lot of people are continuing to work because I think right now you have to be 66 in a couple of months to qualify for your full Social Security benefit. And if you want to get the enhanced benefit, you have to work till you're 70. So there are a lot of people who are working beyond the age of 65. And if you're working for an employer with 20 or more employees and getting your health benefits from them, you would be able to delay your Medicare Part B enrollment without any kind of penalty because you have other insurance. And if the company you're working for has less than 20 employees, you do still need to enroll in Medicare, because Medicare is your primary insurance if you're working for a small employer. So those are really, the rules really go around, when is Medicare going to be primary? So if you're working for a large employer, which is 20 plus in this case, then Medicare is secondary to whatever you have. If it's a small employer, then Medicare is primary. Okay. And how do we enroll in Medicare? I said it was through Social Security, so the local Social Security offices are open. Once again, I think it happened in April. For walk-in appointments, but they really do encourage folks to use their online services at ssa.gov, or at least to call to schedule your appointment in advance, because they are very crowded, right? And you don't want to have to go there and sit. So you can enroll in Part A online or in person. You can call them. Enrollment in Part B, so at the age of 65, during your initial enrollment period, you can enroll again at ssa.gov. You fill out the Form 40B. You can fax or mail it or drop it off to them. And after your initial enrollment period, so this would be like if you still were working and had active employee insurance through a job, you need to fill out two forms. One is the 40B, and the other is the L564. And the L564 is you complete part of it, and your employer completes part of it, saying that you had coverage. And that's how they prove that you didn't have, you're not going to be subject to a penalty for late enrollment. Okay. And the telephone numbers for the local offices. 877-405-0475 is for the Neptune office, and the folks in the upper part of the county, Middletown area, Highlands, Atlantic Highlands, they're going to use the Iceland office, 800-772-1213. Any questions? All right, so we'll talk a little bit more about delaying enrollment in Medicare Part B. Mentioned a lot of these things already. If you're still working, have health benefits from a large employer. Again, if that's 20 or more employees. If you're retired but covered as a dependent on a working spouse's large employer health plan. So if you yourself are not working but your spouse is still working and has coverage and you can get coverage through them, you can delay enrollment. You can enroll in Medicare Part A only and defer that Part B until retirement or till you no longer have or want your employer plan. Part A, again, is the hospital coverage, and for most people, it's free if you've worked 40 quarters or, again, have coverage through a spouse for that, credit through a spouse. You can have free Part A, and so a lot of people do decide to take that because it's just extra coverage, would come in behind whatever other, it would be secondary to whatever other coverage you already have. And there is a different definition of large employer and small employer if you are receiving disability insurance. So again, for those who are 65 and not disabled, it's 20 or more employees is considered a large employer, where Medicare is secondary. If you are disabled, a large employer is 100 or more employees if on Medicare due to disability. And in that case, Medicare is primary only if your employer has 100 or more employees. When do you need Part B? So when you have health benefits from a small employer, we just kind of went through that, 20 employees or less, 100 employees if you're on disability. Also, when employer health benefits no longer based on active employment. So that applies to both large and small companies. And when would that be the case? So if you got COBRA, so maybe you were laid off. COBRA always pays secondary to Medicare. So if you become eligible for Medicare when you're on COBRA, you need to enroll. because otherwise you're going to be responsible for that payment, because COBRA will not pick up what Medicare should be paying. Or when you have retirement. So, some people, serve, work for a number of years, then take early retirement well before they're 65, and they are on retiree insurance. When they turn 65, they need to enroll in Medicare because that retirement insurance will not pay until Medicare pays. Right? So you don't want to be stuck with a big bill. Okay? And also, obviously, when Medicare is your only health insurance, you need your Part B coverage. Special enrollment periods for Part B. So you can enroll in Part B within 8 months of the end of employer or union health care plan coverage or employment. However, if your plan ends on August 31st and you're taking advantage of that 8-month window, that means you have 8 months when you don't have coverage. So most people are not planning to have 8 months with no coverage. Most people, when they know that that coverage is coming to an end, is they're contacting us or, other sources of information about what they should be doing and trying to line up that coverage so that they don't have any gaps. You can enroll in Part B anytime while you're covered by employer health plan based on active working status. And there's no late enrollment Part B penalty when you have active working status and no coverage. All right, we talked about this. Medicare becomes primary immediately when employment stops, even if continuing coverage under COBRA, so you should enroll in Part B right away. Don't wait the 8 months. COBRA or entiree plan may not pay in full if there's no Part B. And there's a lot of details here. So, the high level really is, oh, I heard something about COBRA that I need to be concerned about. I don't remember exactly what it is, but I need to investigate it, right? So we're going through a lot of the rules here, but some of those, you just kind of keep those big concepts in mind. Medicare Part A. So what does it pay for? This is the hospital insurance. It pays for your hospital stay. It pays for skilled nursing facility care, home health care services, hospice care, and actually blood if you need it is covered. So those are the categories of services that Medicare Part A covers. Okay. So as I mentioned before, most people receive Part A for free with no premium. Some people have to pay for Part A, so somebody who has less than 10 years of Medicare covered employment. So that means that it could be, doesn't have to be continuous service, employment. It could be you work part-time for a little while and, then had to leave the workforce for whatever reason, came back, and then, worked a few more years. So it doesn't have to be continuous, it's cumulative. So the other group of people who have to pay are not married to someone with more than 10 years of Medicare covered employment. Premiums for Part A for those who have to pay. If you have less than 30 quarters of work, it's $499 a month. That was the 2022 figure, very expensive. And if you have 30 to 49 quarters, you get a little bit of break. It's $274 a month. And there are cost sharing and deductibles for hospital coverage. The other thing I wanted to mention about Part A, I don't think I covered in this slide, is the one time that you may not want to enroll in Part A when you're first eligible is if you are contributing to a health savings account. So not an FSA, not your flexible spending account, but if you have a high deductible plan with employment, your employer insurance, and you're contributing those tax-free dollars to be used towards your out-of-pocket costs, then you can't be enrolled in Part A at that time. So again, just something to keep in mind for when the time comes, and just remember, I need to think about that. Okay. All right. The deductibles and co-payments per benefit period in original Medicare. So the hospital is $1,556 deductible, paid upon admission, and then you're covered for the 1 through 60 days. You must be admitted. Now there's a lot of times people come in and they're just there under observation. So if you're there under observation and then get discharged, that falls under your Part B, your medical insurance. So Part A kicks in once you have been admitted. So days 1 through 60 after you've paid that deductible are completely covered by your Part A insurance. If you're there for 61 to 90 days, there is a $389 per day fee. And if you're there 91 to 150 days, that's your lifetime reserve of days, that last 60 days there. And then the copay for being there, that additional time is more expensive. So the skilled nursing facility, you're covered in full for the first 20 days after that, after a minimum 3-day qualifying stay at the hospital. So say you were admitted to the hospital, you're there for 4 days before they discharge you to skilled nursing. If that's the case, you met your qualifying stay at the hospital, and your first 20 days would be covered by your Part A. After that, it's $194.50 a day for days 21 through 100. But hospitals, for the most part, they're not keeping people, for long periods of time anymore. I'm sure there are certain, special circumstances where somebody would have an extended hospital stay, but really, they're there to get people stable, and then, then they're transferred to a skilled nursing facility for really recovery and rehab and all of those things. Just a quick footnote, you could have more than one benefit period in a calendar year. So a benefit period begins the day you go into the hospital or skilled nursing facility and ends when you have been out for 60 days in a row. So if you go back into the hospital after 60 days, then a new benefit period starts and that deductible happens all over again. Part B, what does that cover? Because we talked about A and the hospital services and skilled nursing and so forth. So Part B really is what all the outpatient services, your doctor's services, outpatient medical and surgical services and supplies, diagnostic tests, outpatient therapy, whether it's physical therapy, occupational therapy, outpatient mental health services, home health services, your durable medical equipment, wheelchairs and other things of that nature. Outpatient services at the hospital, because there's a lot of clinics now, that they're doing things there. Blood and ambulance services. So, but an ambulance service is only covered if other transportation would endanger health. So we do get a lot of calls about ambulance services and why they're not covered for certain, in certain circumstances. And just wanted to mention that Medicare does have a quite extensive list of preventative benefits. Some of them are free. We'll go through what it means down here. So it says if a provider, free if a provider accepts Medicare assignment, and we'll talk about that in a minute, what that means. But you get a welcome to Medicare preventative visit. That is not the same thing as a extensive physical exam that you might be used to. So this is more of a consultation with your doctor, taking health history and making kind of a wellness plan. And then you get an annual wellness visit that would be after 12 months of having Medicare. So when you get Medicare, if you're setting up, you're going to go see your doctor and you want to have, your annual visit, you need to be careful to make sure that you're telling them, I'm newly eligible for Medicare, so that they code the visit correctly. However, if you're already seeing your doctor, for a condition that you have and you're going in for a follow-up appointment, that would be your follow-up appointment rather than, a physical. So, that would be covered under Part B. But they have alcohol misuse screenings and counseling, bone mass measurements, breast cancer screenings are covered, cardiovascular disease, a whole number of things there, colorectal cancer screenings, depression screenings. So a lot of different screenings, some of which are, most of them are medical. If you're getting like a glaucoma test, your flu shot's covered, and some of the other ones are, questions that your primary care would be asking you to kind of gauge where you are. So a depression screening obviously would be sort of a question and answer type of thing. Okay. What's not covered by Medicare? Original Medicare, again, we're talking about A and B. So original or traditional Medicare does not cover eyeglasses except after cataract surgery. Does not cover your routine dental care or dentures. Doesn't cover hearing aids. Doesn't cover long-term care in a nursing home. Doesn't cover home health aids to help with bathing, dressing, or housekeeping. Doesn't cover cosmetic surgery. It doesn't cover acupuncture except for chronic low back pain, but that is kind of a common thing for a lot of older folks. So the fact that they cover something for acupuncture and that's relatively new. Foot care or podiatry, with some exceptions, is not covered. Non-emergency medical transportation is not covered. Home modifications like ramps is not covered. And care received outside the United States is not covered. Okay, so our 2022 Medicare Part B premiums in 2022, if you fell into the most common brackets for income, if you were an individual making $88,000 or less, or if you were filing a joint return, $176,000 for the year or less, your premium was $170.10. Those who make higher than that, there is a surcharge on your premium, and that's listed here in the chart. I'm not going to read each one of those, but just again, the concept is if you're over the initial limit, there's a surcharge for your Medicare Part B, and they look at the tax return from 2 years prior. So in 2022, they'd be looking at your income from 2020. Okay. So other costs associated with Part B. So we just talked about the premium. It's $170.10 in 2022. What other costs are there? So there's an annual deductible. The deductible means this is what you have to pay before the insurance starts covering your services. So that was $233 this year. And Medicare covers 80% of your service, which means the remainder, which is called co-insurance, is 20% for most Part B services that you're responsible for under that original Medicare if you just have A and B. There are providers that take Medicare that can charge up to 15% more than the Medicare negotiated amount, and those are for folks who are not taking assignment, so they are not accepting Medicare's payment in full, so they still participate, but they have the ability to charge you an extra 15%, so you might be paying up to 35%. You may want to check with your providers to see, right, if these kinds of expenses are important to you and you're managing a budget, which many of us are. You'll want to, check with your provider to see, what category they fall in. Are they accepting Medicare as payment in, the negotiated amount as the full amount, or are they able to charge the excess charge amount? So quick note, if you have a Medicare supplement policy or a Medigap, they're interchangeable words, we'll cover those in more detail later, or if you have retiree health benefits from a former employer, it usually covers all of these things for you. So what does it mean that we take Medicare? So we're just talking about the situation where somebody might be able to, a provider might be able to charge an extra 15%. So doctors or providers have 3 ways to serve people with original Medicare. So if they are participating or take assignment, you pay 20% of the Medicare rate. That means that that provider has said the amount that Medicare has negotiated with them for your primary, your physical, or your primary visit. They're going to accept that negotiated rate. You're responsible for 20%. If they're non-participating, or meaning that they're non-assigned claims, they can charge you that 35%, that extra 15%. And private contract or opted out, so no claims can go to Medicare. You must pay whatever doctors charge in the full amount.
Non-participating and non-assigned, it could be either or. You can participate but not be, you could also be non-assigned participation.
Those are, so interchangeable terminology.
Okay.
So if someone is participating or take assignment, that means that they're accepting the Medicare negotiated amount as the total amount that they'll receive. They're non-participating or non-assigned claims. They're still taking Medicare, but you would be responsible for the 35%. And then there's the providers that don't participate at all, that don't take Medicare, and you're responsible for the full amount for that. So ways to supplement your original Medicare. So we just went through a lot of the expenses. So there's quite a bit that an individual would be responsible for if you have the original Part A and Part B. So your health insurance from your current or former employer or union would pick up that, as we just talked about. If you had retiree coverage that's secondary to Medicare, that would potentially cover, the majority of those out-of-pocket costs. If you have a Medicare supplement or a Medigap policy from private insurance company, depending on which plan you purchase, some of them would pick up all of those costs. Some of them, if you purchase a plan, you might have a deductible that you have to cover before it starts picking up those costs. You pay out of pocket for Medicare co-pays and deductibles. And if you're very low income, you may be able to get help from the state, from Medicaid, and there are a few other programs that are above the Medicaid level that can help pay for some of those costs. Again, there's financial eligibility criteria for those. We'll talk about those a little bit at the end. All right. So if you are getting ready to retire, or if you have current retiree health insurance, you want to find out from your employer how your plan coordinates with Medicare. So you want to understand, how they're going to work together. Most insurances will have what's called a crossover. What that means is that when you go to a provider, you would show them your Medicare card, you'll show them your retiree coverage card if that's what you have. And the claim, the provider submits the claim to Medicare. Once Medicare processes it, they electronically send it to your secondary insurance. That's called a crossover. Some insurances, your secondary insurances, don't work together with Medicare like that. And in those instances, what happens is Medicare pays. Your provider will send you a bill for the remaining balance, and then you can call your provider and say, I have secondary insurance, you need to resubmit because, Medicare has now paid and now you can go collect from my secondary insurance. It's a little bit more cumbersome, but not all the plans do have that electronic crossover. So you want to understand whatever other coverage you have, is there a monthly premium for it? So, because you could be paying for your Medicare, plus have some sort of monthly premium for your other coverage. Does your other coverage have deductibles? Does it include drug coverage? Is your spouse covered under the plan? So there's a lot of key questions that you need to understand when you become eligible for Medicare, and trying to understand how other coverage that you have may work together with Medicare.
This is just for retiring, not if you want to continue working.
Right, so this would be, right, because if you're going to continue working, you're going to have your primary insurance, and then for Medicare, if you become age 65, you're going to decide if you want to be in Part A only, delay that Part B. Yeah, so if you are, if you have Medicare and you have potential for these other retiree coverages, you'll want to understand how they work together. Because you also may want to evaluate, again, we're talking about Medigap plans a little bit later, you might want to, look at that. What's the cost of that as opposed to keeping your retiree health insurance benefits? And then weigh those against each other. So we've, till now, we've really been talking about this bucket over here, original Medicare, Part A and B, and then the drug coverage we really haven't touched on too much yet, but just to say that Medicare does require that you have drug coverage. And we've made some references to Medicare supplement plans. The other way you can get your Medicare coverage is through the Medicare Advantage plans. The HMOs or PPOs, HMO has a fairly narrow network of providers, and you don't have coverage if you go out of the network. The PPO plans have a network in which you have lower costs, but then they have a broader network of providers that you can see and pay a little bit more. The Medicare Advantage plans also typically include Part D. There are a few that don't have Part D included in them for people who are getting maybe VA benefits or something like that where they have creditable coverage elsewhere. But most people who are signing up for Medicare Advantage plans are also using that as a way to get their drug coverage. Okay. So we're going to talk a little bit about those Medigap plans or supplemental insurance plans. So they are sold by private insurance companies. They cover the gap in original Medicare plans. So that gap consists of your Part A and B deductibles, co-pays, and co-insurances, which we went over with the hospital and also with the Part B, also called Medicare Supplement Insurance. So there are 10 standardized policies available. What that means, standardized means that, so if you buy Plan A, or if you're looking at Plan A, and Transamerica might offer Plan A. There's about 25 different insurance companies in the state of New Jersey that offer these plans, but I'm just throwing out some common names. Transamerica offers a Plan A. United Healthcare, which AARP sells the United Healthcare plans, they have a Plan A, and Mutual of Omaha, their Plan A. So the benefits of Plan A for every single one of those companies and all the other 20 of them are exactly the same. But the private insurance companies, they set the premiums for those plans. So, you may be paying, A for Transamerica and B for United Healthcare, and C, the premium would be yet something else.
All the Plan A's would have the same premium?
No, they have the same benefits.
They have the same benefits.
But the premiums vary because the private insurance companies are setting those.
And these are all not the same as Medicare Part A, which is a little confusing.
I know.
Okay. Yep.
Exactly. So plans of the same letter have the same coverage, only the premium costs are different. One of the benefits of having a Medigap policy is that you can go to any doctor, hospital, or provider that accepts Medicare in any state. So it kind of is, it's nationwide coverage, right? And with original Medicare, that's why a lot of people go with the original Medicare, even if they're not purchasing a Medicare, Medigap or a Medicare supplement plan, because they can go anywhere. A lot of folks who do a lot of traveling or maybe, visit family or friends for extended periods of time, and they're in other parts of the country, they're looking at the original Medicare plan as something that is, of interest to them.
So that would mean if they take Medicare Part B, they're also going to accept any of the Medigap plans as well? Your provider?
Well, you would be eligible to enroll, you would be eligible for a Medigap plan if you have Part A and Part B.
But I'm saying your provider, if they take Medicare, they're
Yes.
also going to take the Medigap.
They would also take, exactly.
Okay,
And, you go and show both cards.
right.
Okay. On the other hand, if you have retiree coverage, you probably wouldn't be looking at you wouldn't purchase a Medigap 2 because that's like 3 layers of coverage and
Yes.
you might be paying more than you need to have a robust coverage.
Yes.
On the other hand, you might want to weigh the cost of your retiree coverage against the cost of the supplement plan and how much they cost and the usage that you might expect, and that's how to decide.
So really, you would need to research what each plan A through N covers, decide which coverage you need, and then go out there and find the company that has the lowest premium cost for that plan?
People do look at it from the lowest premium standpoint. There are some some nuances as to why you might want to choose a plan that is the premium is set in a slightly different way. The cheapest plan today is not always the cheapest plan 10 years from now. But again, that is something that a counselor could advise you on. I'm just going to show you some of the. One of the things that our counselors have is we call it our benefit star chart for the Medigap plans. It's an easy way, it compares all of them, and is an easy way to see what one covers versus another one of the plans. We can also provide a list of the telephone numbers for all of the insurance companies that sell Medigap plans in the state of New Jersey. And we have a chart for people who are 65 that compares the premiums for every single one of those plans. So that's a great, it's a great service to anybody that's coming for us to be able to kind of look at that and say, oh, okay, this one is, if I'm 65, this is what it's going to cost. They're not down to the penny, so sometimes we find people call back and they say, well, it was a little bit more. And it's like, well, but it gives you an idea of, what the premium is and how it compares to some of the other insurances.
That would be a lot of research to do on your own.
Oh, absolutely.
Yes.
Yeah.
Very time consuming.
Sure. So you pay a monthly premium for a Medigap in addition to your Medicare Part B premium. It's anywhere from $100 if you're buying a plan that is not the most extensive coverage. You might be paying somewhere in the $100 range, and up to $350 per month. Usually when you are 65 years old, you're not paying $350 a month, but a lot of the plans are what they call age attained. So as you get older, your premium goes up. There are some community rated plans that are a little bit more stable in terms of their premium progression, so that would be one of the reasons why you might look at something that's not the cheapest plan, but might have a little bit more of a stable premium progression. The Medigap pays claims after Medicare pays, only covers Medicare services. So if Medicare is paying for that service, and your Medigap would come in behind and pick that up, depending on which Medigap plan you chose. Again, there's different levels of coverage. A company can turn you down for coverage after your first 6 months with Part B. So we have what's called the initial enrollment period for Medigap, during which they have to take you. They can't medical underwrite you. They can't delay your coverage. If you've had, if you had active employer insurance coming into, or even if you had family care and Medicaid coming into your Medicare coverage, you can't be turned down, and you are guaranteed their best price. So when you are first eligible, it does not cover prescription drugs. back in the day. It did, some of the plans, but no longer. And so you need a separate Medicare Part D prescription drug plan when you take the original Medicare A and B and a Medigap. You need a separate standalone drug plan. So the Medigap open enrollment period or initial enrollment period, the first 6 months after you have your Part B effective date. Again, that doesn't have to be 65, because if you delay your Part B enrollment because you're still working to 66.4 months, whenever you're going to be, fully vested in your Social Security benefit, you still have that 6 month, that's your Medigap open enrollment period. So you have the right to purchase any Medigap policy sold for your age group. You can't be turned down for medical reasons. It must be offered at the best price. But you only get one of these per lifetime. So unless you're starting Medicare due to disability. So if you happen to be starting Medicare, you've been designated as disabled by Social Security, your Medicare kicks in 24 months later, and say you're 55. When you turn 65, you will get another opportunity to have a open enrollment period. And most people take advantage of that because the premium, if they purchased a Medigap in that original time when they were eligible, when they turn 65, that premium will be lower because they're in a bigger pool of recipients at that time. Pre-existing conditions and waiting period may apply if you had no prior coverage. Like I said, you would have, if you had New Jersey Family Care coverage, that's expanded Medicaid coverage in New Jersey, that counts as prior coverage. If you're working and you're getting your health benefits from your employer, that would be considered prior coverage. If you have coverage through the New Jersey Marketplace, that would be considered prior coverage. So there are certain times, though, when you qualify what's called a guaranteed issue situation. So that's the right to purchase only certain Medigap policies. You must be offered the best price for the policy at that time. You can't be turned down, and then there's no pre-existing condition waiting period. So let's see the next slide. We're talking about what those guaranteed issue situations are. So a Medicare Advantage plan ends because the plan is leaving the Medicare program or stops offering coverage in your area, or you move out of the plan service area. So we did have last year, we used to have a Horizon plan through Medicare. There was a Medicare Advantage plan, and they are no longer being offered because they've been the Braven plans are now kind of the substitute for those Horizon plans. So the folks that were in that Horizon plan would have had the opportunity to purchase a Medigap plan with no Medicare, no medical underwriting, because that plan left the area. Okay. And if you move out of the plan service area, you have an opportunity. So not every Medicare Advantage plan is offered in even every county in New Jersey. Some of them are much more regional or kind of local. So even if you were to move to, and it's not true for every Medicare Advantage plan because some are statewide, but if you're in one with a smaller network and you move to an area of New Jersey that doesn't offer that plan, you would have a guaranteed issue situation to pick up a Medigap plan, and certainly if you leave the state.
Well, is it where you live, or say you move from Monmouth County to Ocean County, but you can still come up to Monmouth County to see your doctors? Does that mean you could stay in that plan?
If that's where you want to continue to
Okay,
get
so
services.
it's not dependent on where you actually live. It's where you want to see the doctor?
Yeah, I think so.
Okay.
The beneficiary is covered under an employer group health plan. That plan terminates. You must be losing your coverage involuntarily. So if you are, that includes your COBRA and your retiree group health plan. So if they, for some reason, were to terminate their coverage through no fault of your own, you would be eligible to purchase a Medigap without the healthcare underwriting. Okay. little bit of a gray area here, retiree plans that change from a supplemental to a Medicare Advantage employer plan. That's happening quite a bit, where plans that used to be more like supplemental coverage are now becoming more like Medicare Advantage plans. I definitely recommend consulting, us or another provider, a broker or someone, about whether or not you would be able to purchase a Medigap plan in that circumstance. Beneficiaries Medigap plan terminates because the insurance company goes broke or bankrupt. So it's a little bit like your banking insurance, right? We have the FDIC, so here, if you have purchased a Medigap from a company and they become insolvent, you have the guaranteed right to get another coverage from another plan without healthcare underwriting. Because some of those names, 25 names on that list, are going to be names that you haven't necessarily heard of. Some people go looking, at AM Best ratings and some other kinds of insurance company ratings because they want to make sure what they're picking is going to stick around. But just for those who, might feel a little uncomfortable because they haven't heard of a certain insurance company, just, you have the backing here from the state that you have the ability to purchase another one without healthcare underwriting. If the beneficiary leaves a Medicare Advantage plan or drops a Medigap plan because the company hasn't followed the rules or misled you. So you do need to be able to document those situations. You can't just say, hey, somebody didn't tell me, I didn't understand what I was being told, right? If you're able to provide some documentation that you were misled, then we do have the opportunity to take advantage of the guaranteed issue situation. And then there's the Medicare Advantage trial rights. And I think we probably don't cover that. Okay. So the Medicare Advantage trial right is that if you initially enroll in a Medicare Advantage, in original Medicare, and you have that for a period of time, and with the Medigap, and you decide, I really want to give Medicare Advantage a try, you can do that and keep that Medicare Advantage plan for up to 12 months. And then you would have a guarantee, and if you decided at the end of the 12 months, this just didn't really work for me, or you decide after 3 months it didn't really work for you, you would have the guaranteed issue right to purchase another Medigap plan, or go back to the one that you had before, if that one is still being sold. So it gives people a chance to take advantage of another kind of coverage and basically try it out.
So this is what you would refer to as not original Medicare. We used to talk about original
Medicare
Medicare.
Advantage, yes, but the guaranteed issue situation that we're talking about applies to the Medigap supplements that you would be purchasing to help cover those cost sharings under original Medicare. So the Medicare Advantage is another way to get your coverage, and we'll talk about that in a minute. Okay. Just wanted to say that they do offer kind of the ticket for a trial run. That's why it's a trial run, is you get an opportunity to try it, see if it works for you. This is the star chart I was telling you about. We're not going to go through it in a lot of detail, but you can see it's got plans A through N, although it's not every single alphabet letter. Too bad that they didn't skip the ABD part, because it wouldn't not be confused with the parts of Medicare. But the most robust plan is the Plan G, where you can see it picks up that 15% charge, the excess charge, so that's covered under the Plan G. Plan D, if you are under age 65 and on Medicare due to disability, with your effective date for Medicare was January 2020 or later, you can only purchase the Plan D. So if you have, and it's the only thing it doesn't cover that the Plan G covers is it doesn't pick up that 15% excess charge, but it's again it's a very robust coverage. And then just realize that there are other options, and give us a call if this is something you want to consider, and we'll walk you through what makes sense for you, talk about them, and you can get a more specific education, but just kind of a quick overview of the different kinds of plans that might be available. Okay, ready to get more information on Medigap's? You can call 1-800-MEDICARE and ask for a free publication called Choosing a Medigap Policy. You can call companies selling Medigaps to get a premium quote. Again, we can provide you with that list of all companies that are selling Medigaps in New Jersey and their telephone numbers. And you can, that list is also available here at aging.nj.gov, or you can call your local SHIP office. We're 732-728-1331, and we happily provide you with that information, that star chart, the premium matrix that I told you about. All of those things are available just by calling us. Any other questions before we move on to the drug coverage? Okay. So, prescription drug coverage is standalone prescription drug coverage. That would be the drug coverage you would purchase if you went with the original Medicare, A and B. Whether or not you choose to pick up a Medigap is completely separate. You are responsible for having Medicare coverage, or you're responsible for having prescription drug coverage. One of the ways to get that is through Medicare, but you might also have it through your retirement coverage. You might have VA benefits and so forth, other places that you might get what's called creditable coverage. You get a statement from your insurance company every December, and it identifies whether or not that coverage is creditable. Of course, not everybody's saving that letter. So if you're in the circumstance where you're wondering, that is the terminology that you would want to make sure that your coverage is creditable. Medicare Advantage plans, most of them, as I said, do come with prescription drug coverage. And it offers, again, the Medicare Advantage is both medical and your drug benefit. And the drug benefit is going to be structured similarly to these standalone drug plans. That's the creditable coverage, which is deemed at least as good or better than the basic Part D plan. Drugs that are covered by Part D, they must be available only by prescription, so you're not getting supplements or over-the-counter medication under your drug plan, Part D. It covers both brand name and generic drugs. They must cover at least 2 drugs in each treatment class. It covers insulin and supplies for injecting insulin, and some of the vaccines that are covered. So the shingles vaccine would be covered under your Part D. Flu, pneumonia, hepatitis B, those fall under your Part B coverage. So plans have what's called formularies, because there are many, many drugs. We just talked about how there was the drug plan has to cover two drugs in each class. But there's many, many, many medications out there. So the formulary is the list of drugs that a plan has chosen to cover. It may not include your medication, but it will typically cover similar drugs for your condition. Many plans place drugs in copay levels, referred to as tiers. Tier 1 are your preferred generics. The higher the tier, usually the more expensive the cost. And some categories of drugs are not covered. So, like I mentioned, prescription vitamins. So, for example, vitamin D, you could get, you might get a prescription from your doctor for it, but it's not going to be covered. Cosmetic drugs like Rogaine aren't going to be covered, and lifestyle drugs like Viagra are not going to be covered under your plan. So if, back up here, if your medication is not covered, so there are a couple of things that you can do. I'm not sure if we got there yet. So you could ask to be switched to a different medication. So say you go into your doctor's office and you have a new condition and they want to prescribe something for you, and you take it with you and you go, or these days it's all electronic. You go to the pharmacy and your pharmacist says, oh, this is going to be $100, and you're scratching your head, and they say because it's not covered under your formulary. So at that point you could go back to your physician and say, hey, this isn't covered under my prescription plan. Is there something else similar that I could take? And your doctor can work with you on that. And then if you truly need something else won't work, then it's possible to ask for an exception for your plan. Your physician can work with you on that. You may be able to get it covered temporarily, and then when open enrollment comes around, like it's coming around in October, you could call us or go onto Medicare.gov yourself and find out what Medicare drug plans do cover that medication, and then switch your enrollment for your drug plan for the next year, so that you have the access to the medication that you would like. All right, plans may have rules for covering some drugs, so they might have quantity limits. They limit the number of pills that you can get at a time. They may have prior authorization, requires you to get approval from the plan before you can get the drug, or they may require step therapy, which requires you to try a preferred brand name drug first before using a non-preferred name drug. And not every plan is going to have the same rules for the same medications. So frequently quantity limits, those may be more consistent across plans, but you might find some differences in prior authorization requirements for the same medication. It's not that it's not that you would necessarily be denied, but if you had the choice between a plan that was going to cost you almost the same, and it required prior authorization for your medication, or you had another plan, again, costing almost the same, that doesn't require that little extra step, people would typically choose the one that doesn't require prior authorization. And that information is information that our counselors have access to. And again, if you're doing it yourself on Medicare.gov, which is, you can do that, that information is available there. And the same thing may be true with step therapy, is that some plans may require that for a particular medication, and other plans may not.
Mm-hmm.
Okay, costs. So there is a premium associated with your Part D plan. The median premium in 2022 was $42.43. However, the least expensive plan was $7. So a lot of people who are not taking any kind of medication but know that they're required to have a plan, they may buy that $7 plan because it's very inexpensive but still meets the coverage requirements. There are a couple of other plans, like in the $11 to $15 range, that people choose as well, because there's some different benefits to that. But they go as high as $100 a month. So somebody who is on a large variety of medications may find that that plan is the most cost effective for them, because there's a lot of things that go into what your overall costs are going to be. So there's the monthly plan premium, there's the deductible for the plan, and then there's your co-pays that you pay when you go to the pharmacy. And then there's whether the pharmacy is a standard pharmacy or a preferred pharmacy. Mm-hmm. So there's a lot of elements to that. The Medicare.gov website does it's a terrific tool People can go there and create their own account. You can put your drugs in there, and then, you know, it will go through all of the plans and sort based on what is the least expensive for you. Not everybody is as computer savvy as they would like to be, or necessarily feel that level of confidence, and our counselors do this all the time. We do it, you know, throughout the year, but it's particularly a busy time come fall open enrollment, which starts on October 15th and goes to December 7th. Okay. So deductible, you may pay the full cost of some drugs. Excuse me. So some plans have no deductible. Those are typically those higher plans, those higher premium plans. And other plans, they can charge up to $480 deductible. So again, you pay your premium every month. Your deductible is what you have to pay upfront before you start getting the benefit of the coverage. And for a lot of plans, the deductible does not apply to Tier 1 and Tier 2, those lowest and most, the cheapest tiers of drugs. Some plans, it doesn't apply to Tier 1, so again, we have all this information. We've got charts and things to share with people to really give them a overview of what kinds of things are available. Initial coverage period, so you pay copay or core insurance until you reach $4,430 in total drug costs. So that's a combination of what you're paying plus what the insurance company is paying. And then you reach the coverage gap, or called, a lot of people have heard of it, referred to as the donut hole, where you pay 25% of the cost for either the generic or the brand name drug. So it's a 75% discount, but you know, everybody knows how expensive medications are. 25% can still be quite a bit. And you do that until your out-of-pocket cost for the year reaches $7,050. Okay, note that 70% of the discount paid by the drug manufacturer for brand name drugs will count towards your outstanding out-of-pocket costs. So that $7,050 is not literally everything out of your pocket. So some of what the drug manufacturers are contributing in terms of cost gets factored into that number. And then once you reach that, you enter the catastrophic benefit, where you pay a small copay, $395 to $985, or 5% of the cost, of course, whichever one would be higher for the rest of the year, but still a significantly less than the 25%. Okay, so I mentioned a minute ago about the fact that where you get your drugs filled can definitely affect the price. So if your pharmacy is, you know, you need to make sure it's in the network. I think most pharmacies are in the Medicare drug plan networks, but really the cost savings come in here is if they are a preferred pharmacy that has negotiated preferred pricing with the drug plan. It can be significantly cheaper to go to a preferred pharmacy, or if it's, you know, a standard pharmacy is standard pricing. Again, the Medicare.gov website will be able to tell you that information. Our counselors work with that information and, you know, can definitely inform you about that. So, for example, a copay at a network pharmacy may be $10, but at a preferred pharmacy you may pay $0. Okay. And a lot of times mail order, if it's a prescription that you're on, that you're taking regularly, you know, that's not, you know, take as needed, or, you know, something new that you're trying to figure out what level of medication is the best level for you. So if you're on something that you take regularly, a lot of times mail order is a good way to save too, because you get 90 days at a time. How to compare plans? So, of course, the first thing that you want to know is, are my drugs covered, right? No point in getting a plan that doesn't cover your medications. But are any of those prior authorization or step therapy requirements part of the plan, something that you would want to know. You want to look at the cost, the premiums, the copays, the deductibles, and estimate your total annual cost. So it could be, you think you're saving money by enrolling in that $7 a month plan, but when you put your medications in there and all of these other factors are considered, the $7 plan may not be your cheapest plan. So again, Medicare.gov website, and our counselors who use that website, who are trained in it, can definitely help with that conundrum of what's going to be the cheapest for me. Convenience is the pharmacy in your plan's network. Does it offer mail order? And does it have, is it preferred pharmacy with those lower copays? And will it work with my other health or drug benefits? So you want to make sure that that all works together. This is the Medicare.gov website that I've been mentioning. You just go to Medicare.gov and you can compare plans. You can create an account there, which will, you can record all of your medications, especially, if you take more than 2 or 3, it saves it. You can go back next year if there's been any changes, or you can update it at any time, frankly. So it's a great place to, warehouse that information, and then when it is time to compare, if you want to compare your drug pricing or plans for open enrollment to see if you're still getting the best value for your dollar during that open enrollment period, everything's really already right there. And it makes that a pretty simple process. So we recommend that people create that to make it, got everything stored and handy. But you can also go in there with, you can go in as a guest, basically. Put your medications in. It doesn't save them, but it still allows you, and that's what most of our counselors do, because, a lot of times people that are working with us haven't created an account, so we can go in as a guest, put their information in, and generate the, what are the, these are the 3 least expensive plans, here are the details about them, and share them with you, and then, they can, the individual can then decide how they want to, which plan they would like to choose, if they want to change, etc. Just know that, once we've done that and we're done and we leave, that information is not saved if you don't have an account set up. So here we go, we're going to find plans. All right, what if your prescription is not covered by the plan? We talked about this a little bit earlier in the circumstance, like you get diagnosed with something in the middle of the year and your doctor prescribes something and you head to the pharmacy and you find out it's not covered. So you can contact your doctor, work together with the drug plan to switch to a similar drug, which is on the plan's formulary. That would be the easiest thing to do, because your doctor's going to be familiar with, okay, this other medication does something very similar, and let's try this one. If switching drugs is not feasible, you can request an exception to have it covered. Typically, that will cost you more than if you were to pick the drug that is similar. And but again, you have the right to appeal if they say no. And you always have the opportunity each year to change your drug coverage by, working with somebody or doing yourself, during open enrollment. Make that change during the October 15th to December 7th time frame, and then that coverage becomes effective for January 1 of the following year. And that's here to change your plan during open enrollment. All right. Just like Part B, the Medicare, the medical insurance, if you do not enroll in Part D when you were eligible, you will have a late enrollment penalty. It will be applied if you didn't have any other creditable drug coverage, if you didn't enroll when first eligible, and you'll be charged when you enroll later 1% of the average national Part D premium for each month that you didn't have coverage. So that could, well, 1% doesn't seem like much. I think the average was $42 and change this year, so that's talking 4 cents for every month. But sometimes people didn't realize for years they weren't taking any medications, and we get a call from somebody who it's been, 5 years that they haven't had coverage. Suddenly they get prescribed something and they're like, oh, right? So that adds up. 5 years is 60 months. So it's added to the monthly premium of your Part D plan when you enroll. So, if you're enrolled in the $7 plan and you're subject to a penalty, whatever penalty that is going to get added to that $7. The penalty continues as long as you're enrolled in any Medicare drug plan. Those mathematicians among us. So the $42 I was quoting was the median price, but the penalty is calculated on the average. So the average Part D premium in 2022 was $33.06. So the penalty would be 33 cents.
It adds up,
per month.
though.
But it does add up,
Yeah.
right? So if you delayed enrollment for 3 years, the penalty would be 36%, or $11.90 would be added to whatever the premium of whatever plan you end up enrolling in. Okay, we're back to our little tree here. We have covered everything under this side, the left-hand side now. We've talked about our hospital insurance, our Part B medical insurance. We've talked about options for Medicare supplement or Medigap policies, and we've just finished talking about our Part D. So the other way to get all of these things is to enroll in a the Medicare supplement insurance is sort of a thing on its own, but to get your Part A, your Part B, and your Part D, the other way to get that is through a Medicare Advantage plan, which bundles everything together. So now we are going to talk about Medicare Advantage. So it's structured as HMOs or PPOs. They're called Medicare Health Plans. An HMO, again, is a provider network where if you go outside of the network, you do not have any coverage. You're responsible 100%. A PPO, preferred provider, I'm not sure what the O is they do have a network. If you stay within the network, costs are typically less. But they do have a broader network of providers that accept the plan. Typically the copays are more. Varies by plan, the percentage or the copay varies by plans. There's a lot of variety there. But just know it is not the same thing as original Medicare. So if you have a PPO, it does not mean that you can go to anybody that accepts Medicare. If you're looking to go to a provider that is not in the network, you need to call them and say, do you accept whatever plan it is? I have a PPO, but they have to, they have to accept that plan. You can't just say, do you take Medicare? And they say yes, and then you get there and find out that they don't take your plan. Okay? So these are private insurance companies that contract with Medicare to provide these plans. You must get all your Medicare services, medical services, and drug plans, drugs through the plan. You may have to use specific doctors, hospitals, and labs. Again, that's very true for that HMO. You have to use those ones. You may need referrals for services and specialists. You may get extra benefits that are not covered by original Medicare, such as vision, dental, and hearing. There are prior years, the dental coverage that was included in the plans was routine for the most part. This year they are expanding some of those, or there's buy-ups available for plans that didn't necessarily have buy-ups before, where you can get a little bit of a better coverage. So there are some changes in 2023 that are coming to kind of enhance the dental services that are available in the Medicare Advantage plans. It is not a supplement to Medicare, not in the same way that Medicare Advantage is considered a supplement. In fact, you can't have a Medicare Advantage plan and a Medigap. can't have them both at the same time. But they are structured differently. So with the, if you have original Medicare and you have your Medigap, you're paying your Part B premium, you're paying your Medigap premium every month, right? We talked about that. Maybe that's $100, maybe it's $150. It's significant, right? But with that extra premium, you're getting a more robust coverage of those cost sharings that we talked about. With the Medicare Advantage plan, we basically talk about it as you pay as you go. So you'll be paying your Part B premium, but there are a lot of Medicare Advantage plans that don't charge you anything more than that. So that, monthly fee for your Medigap that you're talking about doesn't, for many plans in the Medicare Advantage group, there is no extra fee. Some of them there is, and we have a lovely comparison chart. I don't know that anybody else does it in Monmouth County, where we have a chart that compares like 20 frequently used services for all the Medicare Advantage plans that are offered, so you can kind of see what that structure looks like. But you pay as you go. So if you need to go to a specialist, you pay the copay for the specialist under your plan. If you need to have lab work done, there'll be a little copay for that. If they send you for a CT scan, there'll be a copay for that. So one of the things that people have to consider is, what is my medical usage? What am I how frequently am I going to the doctors? Because sometimes those copays can add up. For somebody that is at using lots of medical services, they could add up to the point where you are paying as much as you would pay for a Medigap policy or more, and potentially not getting as much coverage as you would have. A lot of people who end up needing dialysis services where you're paying 20% every time you go, and you're going for, a couple times a week, and that's kind of a long-term situation, that can really add up. But of course, by the time you need that coverage, if you haven't purchased your Medigap early on, you can't really go to the insurance company. At that point, you're subject to medical underwriting, unless you're in that window. Because we talk about it like car insurance. You can't have an accident and then go and try and get coverage. Medigap is really kind of conceptually, I want to be covered. I want to be covered, because life's full of unknowns. But also you have to have the financial capacity to pay for that extra premium. So the Medicare Advantage plans, as I said, many of them do not have any extra cost, on a monthly basis besides your Part B premium, and then you pay as you use your services. Some of them will have an extra premium. Again, our charts will, help people figure that out. The cost sharing is different than original Medicare because you owe a copay and not that 20% or 35%, depending on who you're seeing. It's usually a set amount. And different inpatient deductibles and amounts, for the Part A hospital insurance. And it varies from plan to plan. The Medicare.gov website, that plan finder, the same one we referred to with the drug coverage, will also, people can go on there and put in their drugs, and if they're looking at Medicare Advantage plans, it will do a comparison for you as well there. So the additional supplemental benefits that are offered by Medicare Advantage plans, so these are things that were not covered by original Medicare. I mentioned the dental, the vision, and the hearing. Previously, they just included discounted memberships and the routine dental services. So some of the new things that are being added would be the more comprehensive dental benefits with an upcharge that I mentioned. Some of them have home delivered meals after a hospital stay, which is a nice benefit because you're coming home and not feeling up to or capable of cooking something nutritious for yourself at a time when that's really important for healing. They may have what's called an over-the-counter benefit for health-related items. So they give you a card, and again, it depends on, you might have to go to CVS to use it. in some cases, it's restricted that way, and other cases, you might be able to go to Walmart or Walgreens or that type of thing. Some of them have limited transportation to medical appointments. You might get like 10 a year, but that they would provide transportation for that. Worldwide coverage for medical emergencies. And some of them also, they began covering for if you have a chronic disease. Some of them were offering an option to the over-the-counter benefit would be to get like $50 in healthy groceries for the quarter. So sometimes there's some options here in terms of what that coverage might be. All right, Medicare Advantage rules to keep in mind. So the doctors and the hospitals can leave the plan network at any time, but you can't leave the plan until the next year. Medicare will not pay for out-of-network services. So if you're going out of your network and you're in the, even if you're in a PPO, like I said, if you try to go to a provider that is not accepting that insurance, you're going to be responsible for 100% of the cost. So really you want to make sure if you're trying to see somebody out of the network, again, call ahead, make sure that they accept that PPO insurance. If you want drug coverage, you must get it from the Medicare Advantage plan. You cannot have a separate Part D plan. But again, there are some Medicare Advantage plans. Typically, it's people that have VA coverage, but there may also be some people that have federal employee benefit medical insurance that are getting their drug coverage through that. So there's some carve-outs, but most people will be getting drug coverage through their Medicare Advantage plan. Like original Medicare, if you're denied a service, you do have the right to appeal. The process is different, but you still have that right. Copays and services can't increase during the year, so you know your costs up front, what that's going to be. If you move out of your county, you may have to change plans. If you move out of New Jersey, you must change plans. So I discussed about the county issue, because if your plan may be offered in the next county over, and so there would be no need to change. You would be able to continue service. And it does seem like, from the fall updates that we're getting, in New Jersey, there are not too many plans that are just offered in like 2 counties. The general service area is somewhat larger than that. And some of them are, a good number of them are statewide.
But you also get worldwide coverage. Did I see that on the previous slide? So maybe not state to state, but we get worldwide coverage for medical emergencies. Okay.
And I think that was also true of the Medicare.
The original?
If you bought a Medigap, some of them have worldwide coverage, but original Medicare itself does not. But there are many countries with socialized medicine that they would provide coverage while you're there. It really just depends on where you're traveling.
Yeah.
Okay. And if you have a complaint about your plan, you can call 1-800-Medicare. So we talked about this trial situation a little bit earlier when we were talking about the Medigaps. So if you cancel a Medicare supplement policy, this would have been, so last year, so 12/31/22, so coming up at the end of the year. If you cancel your policy to enroll in a 2023 Medicare Advantage plan for the first time, so you've had original Medicare, right, with a Medigap, you decide you want to try a Medicare Advantage plan, you want to try a Medicare Advantage plan, you have the right to do the Medicare Advantage plan trial. The other trial situation is if you enroll in Medicare Advantage plan when you're new to Medicare at age 65. So if you're delaying enrollment in Part B because you're still working, this one does not apply to you. But if you pick up Medicare when you are turn 65 in that initial enrollment period, and you picked it up as a Medicare Advantage plan, then you have 1-year trial where anytime during the first 12 months in the Medicare Advantage plan, you can disenroll from the Medicare Advantage plan and return to original Medicare. You can enroll in a Part D drug plan, because you need those together at that point, right? You're in original Medicare. And you can purchase any Medicare supplement policy and not be turned down, which is the guaranteed issue right there. So there's two situations where you can, give the Medicare Advantage a try and see whether or not it will work for you. But you have the ability to leave that plan and return to original Medicare, or in this case, pick up original Medicare. Okay. So how do you decide? What do you want to do? Do you want original Medicare? Do you want Medicare Advantage? We've talked about some benefits for each of those. So you might want to stay with original Medicare if you have health coverage for an employer or a union and want to keep it. So if you have retiree coverage, a lot of times that comes with drug coverage. So you may want to keep your original Medicare, because if you go for a Medicare Advantage plan and you have drug coverage from your employer, they won't uncouple it. So it will cancel that retiree plan in favor of your Medicare Advantage plan. So a lot of folks who have retiree coverage and want to keep that bundled benefit will go with the original Medicare. If you have a Medigap policy and want to keep it, that goes with original Medicare. As I mentioned, if you're a snowbird and you travel for long time periods outside of New Jersey, you may want to keep original Medicare to have access to that widest possible network. You cannot enroll in Medicare Advantage and use a Medigap policy or most employer retiree health benefits. Again, just mentioning that those benefits, those retiree benefits, oftentimes come with drug coverage, and so you can't bundle those without canceling one of them. All right, and questions to ask before enrolling in a Medicare Advantage plan, because those come with more rules, right, than the original Medicare, where you can go, to anybody that accepts Medicare. Are your doctors and hospitals in the network? So if you're working with one of our counselors, the first thing we do is take your drug list, because you want to make sure that all the drugs that you're taking, that you know about, that you're taking, are going to be covered by that plan. Then we start looking at, what deductibles, if it's a plan that has deductibles, what you have to pay. So what are the overall costs of the plan? And what are the co-pays for your frequently used services? You want to understand what those are. And is out-of-network coverage offered and at what cost? So, maybe once you've sort of looked at what plans are available and would be least expensive for you, you're starting to check in with your doctors and your hospitals, and you find out that, your specialist that you really wanted to see is a PPO, so they take the plan, but they're not in network, and it's $50 to see them. So if maybe that's somebody you check in with maybe twice a year, maybe that works for you and you pay the $50, because the price for the in-network specialist, the same cardiologist, but a different one that's in the network, maybe they're $30. So you're talking $100 that you would pay versus $60 if you saw an in-network doctor. Is it worth $40 to you to keep the same provider? For most people, probably true, right? Are referrals required? Definitely an issue for some people, right? If you're going to see specialists or think you might need to, see a provider besides your primary care doctor, it can be a hassle sometimes if you have to go for a referral. So something that people consider. And I don't know why this bullet point is last. I really should put it up there first, because that's the first thing we considered is, are your drugs covered? As a way to narrow down, because there's like 30 plans. So, how do you pick which plan you might be interested in? Really, the first consideration is the drugs, and then you start looking at all of these other things. And is your hospital in the network, I think, would be the next piece right after that. But then are my doctors covered? Hospital affiliations are getting broader. There were, like 2 years ago, there were some that were only affiliated, some plans that were only affiliated with specific hospitals. It's getting better, so that more plans are signed up with more hospitals. But it's still, you need to check and make sure. Okay. your initial enrollment period for your Part D drug plan and Medicare Advantage plans, your initial enrollment period, 7 months beginning with 3 months before your Medicare eligibility and 3 months after. So it's the same enrollment period as original Medicare, because what's happening is you're enrolling in Medicare, so you're going to get that red, white, and blue card, and then if you pick Medicare Advantage, you're going to get another card. So if you're in a Medicare Advantage plan, which is your A, your B, and most times your D, that will be the only card you will show to your provider and your pharmacy. If you went with original Medicare, you'll show your red, white, and blue Medicare card. Your supplement card, if you got one, would be your provider. And when you go to a pharmacy, you would show your pharmacy card. So you would have a separate card for all of those things. But if you're in Medicare Advantage, you still do have, you're enrolled in Medicare, so you're going to get that red, white, and blue, but your coverage is all going to come from your Medicare Advantage plan. And that's who gets the bills. Medicare doesn't get the bills. So you have your annual election period, which is this fall open enrollment that's coming up. So you have an opportunity to relook at the plan that you're enrolled in and make different choices if you want to during October 15th to December 7th, and those changes will be effective January 1 for the following year. Okay, and then they have Medicare has set up something called the Medicare Advantage Open Enrollment Period. Again, something just to keep in the back of your mind because there's so many details here. But as everybody knows, there's a lot of advertising that goes on during fall open enrollment. People are all over the mail and the news and the TV. And if they haven't talked with us or somebody else who's knowledgeable about Medicare and they just see something that on television that sounds really good and they call up and they decide to switch their coverage, but then come January or February, they try to go to their doctor and they find out that their doctor's not covered by the plan because they didn't do all that research we talked about on the slide before this. This window during January to the end of March gives them an opportunity to switch to another Medicare Advantage plan, so maybe find one that their doctor is in, or they can leave Medicare Advantage altogether and enroll in original Medicare and a Part D plan during that period. So it's a little bit of like people that are having buyer's remorse have an opportunity to fix their coverage so that it will work for them and they're not stuck with it for the entire year. And then we have some special enrollment periods. If you move, again, a special enrollment period is an opportunity to make a change that wouldn't otherwise be possible during that period. You can, if you move out of your planned service area, and we talked about that, you know, depending on the county, if you moved within New Jersey, or definitely if you move out of state. If you lose creditable coverage through an employer or a union plan, that was at least as good as your Medicare coverage. So if you lose that, maybe you lose your position, maybe you lose your job, right? This is a special enrollment period to enroll in a Medicare Advantage plan. And if you enter, reside in, or leave a nursing home, you also have an opportunity to change your coverage there, because sometimes, you know, where you end up may not accept, especially if you were in a Medicare Advantage plan, they may not accept that, or we've had circumstances where just the access to the benefits like physical therapy and things like that, or they get greater access to that if you have original Medicare during that period of time. So it allows people the flexibility to change coverage to get the best possible benefits for themselves. Okay, programs to help with Medicare costs. So we mentioned earlier on Medicaid, that is for the lowest income individuals here in New Jersey, and the income requirement for a single person in New Jersey for the aged, blind, disabled Medicaid, which is the Medicaid that you qualify for once you turn 65 or been deemed disabled, and qualifying for Medicare is $1,000.33 a month. Is very low. But that's what the Medicaid coverage is. Robust coverage. You get comprehensive dental, vision, hearing, so things that Medicare doesn't cover, Medicaid covers those expenses, those items in full. And that's something you apply through social services for that coverage. In addition to that income requirement, there is also a limit on your resources or assets. And if you're curious about whether or not you would qualify for that or any of these other programs, you can give us a call, and we have all of the eligibility information, and we can send you applications for all of these things that fall under the Medicare savings programs. The application for Medicaid, again, you'd get from social services. There's a federal program, low income support or extra help, LIS sometimes it goes by, that subsidizes your Medicare Part D drug plan premium if you have a standalone plan, or if you're enrolled in Medicare Advantage, it would subsidize your co-pays, and it eliminates the deductible. So with Medicare Advantage or with a Medicare standalone Part D plan, this is still of benefit to you because it does subsidize those co-pays. And it's on a sliding scale depending on kind of where you fall in terms of your income and your assets. Again, there's a dual criteria for eligibility. The Medicare savings programs are ones that the SHIP office, where we have the applications for that, is called the NJ Save application. And they cover these 4 plans. So the qualified Medicare beneficiary only, you don't have Medicaid, but the QMB only program will pay for all of that Part A cost sharing. And you can even qualify for, if you don't have enough work credits, it will pick up that Part A premium. So you can get enrolled in that, and it covers all of your Part B premium and your Part B cost sharing. So if you have QMB status and you go to a provider and you show them your, you would show them your Medicare card, and you get a special letter. So then you wouldn't be subject to any cost sharing. However, not everybody is going to take you with your QMB status, so there's a special telephone number we can help people if they're going to see a provider, somebody that they've seen in the past, and now they've applied and they qualify, and sometimes providers will say, well, I don't really take that coverage. We can help them find other coverage. Sometimes if a physician has seen them, especially with primary care physician, if it's a long-time relationship, a primary care physician may say, okay, I'll accept that. Because what it means is that they're giving up that 20% that the individual would otherwise be responsible for. So not everybody is willing to do that, especially if you're a new client somewhere. So we can help people find providers for that. The SLMB and QI stands for Specialized Low Income Medicare Beneficiary and a Qualified Individual. So this plan also is income eligibility and has a resource criteria, resource meaning your assets. Does not include a home, just like your Medicaid asset doesn't require a home. Doesn't, they're not valuing your home if you have one as part of your assets. But really anything else that you can convert to cash. Some life insurance policies have cash surrender values, so that gets counted in there. If your life insurance policy is just a death benefit, that doesn't get counted. But then any kind of 401k or IRA, CDs, savings accounts, all would get bundled into, just determining whether or not your resources would qualify you for this program. So this one covered the all of the Part A cost sharing and premiums, plus the Part B, and subsidized the Part D. The SLMB program covers the Part B premium. So that $170.10 a month, people who qualify for this program, that gets paid for. Okay. The New Jersey PAD, this is pharmaceutical assistance for aged and disabled. So this is only an income eligibility test. And if the combination of medications that you're on fall within certain plans, they'll cover the whole premium for that plan, and then you also have subsidized co-pays, so $5, no more than $5 for a generic, and no more than $7 for a brand name. So this is a huge benefit to people. You know, they don't have the asset test, the revenue, the income eligibility went up $10,000 last year. So, you know, an individual, I think it's 36,800 something in income for the year. As a couple, I think it's 48 something for the year. So really huge benefit to anybody who's taking an expensive medication. We really recommend that people apply for that and can take advantage of, you know, having their drug premium paid for, the monthly premium, and then the subsidized co-pays. And then the last one is the Senior Gold Discount Program. So it does provide some support. So for drug costs, not nearly as robust as the NJ Pad, but if you're on something expensive, it can really help cut down on the monthly cost for that. So it's a, you pay $15 and then half of the remaining amount. So if the medication you were taking was $100, you'd pay $15 and then half of the $85. So I think it turns out to be like $55 or something, like $57 instead of $100 for the same thing. Okay. And again, our counselors can screen you for all of these programs. And we have the application, the New Jersey Save application will cover all of these. And we're very experienced in helping people apply for them, how to fill them out, and so forth. Okay, we talked a little bit about, I said 1033, it's 1133 this year, for the eligibility for, that's Medicaid. Here, who's eligible for Medicaid. And as I mentioned, it pays all your Medicare costs, all the Part A and B premiums, the deductibles, your co-insurances, lowers your prescription copay. Medicare pays first, and Medicaid pays second, and you apply through social services. So just a little recap of what I talked about on the prior slide. And here are the savings programs. Again, mentioned the qualified Medicare beneficiary, the QMB. Just a re-mentioned here, the income eligibility is actually exactly the same as Medicaid, but your resources are somewhat higher. So on Medicaid, the resource limit for a single person is $4,000, but in the QMB program, you can have up to $8,400. And if you're married, filing jointly, the resource limit is $12,600, and for Medicaid, it was $6,000. So it allows people that are still low income, but have a little bit more in terms of resources. It helps if somebody had a small cash surrender value on their life insurance policy to qualify and have all of their cost sharing covered. They're not Medicaid, they're not getting Medicaid benefits, but all of their Medicare cost sharing is covered. Okay. Here. Oh, one of the benefits. So we talked about when I was talking about the QMB before, and I said you might have a provider that doesn't want to see you. So that's true for original Medicare, but if you're enrolled in a Medicare Advantage plan and you're seeing an in-network provider and you have QMB status, they have to see you.
Okay.
Right? So, and they can't charge you anything. There's no copay, like normally a Medicare Advantage plan, you would have copay, but they can't charge you the copay, and they can't say, I'm sorry, I can't treat you. And then this was the SLIMBY program. Here, the monthly income is somewhat higher than Medicaid. So Medicaid was $1,133. You can see here with the SLIMBY program, it's $1,529 if you're single. And the resource limit, it was exactly the same as the QMB program. So there's like little slices that have, you know, somewhat similar, some similar eligibility criteria in each one. You get stepping up from Medicaid, you get slightly less benefits, but, this is still helpful to anybody who's on a limited budget, if you qualify. This is the PAD program I was mentioning, where it's only income related. If you're single, $38,769 a year in income. If you're married, it's $45,270. You have it because you get a bright yellow card that you then would show to your pharmacist along with your Medicare Advantage plan or your Medicare card if that's what you have. Again, subsidized copays, $5 for generics, $7 for brand names. And that is true for some of those expensive medications like Eliquis, which is, common now for cholesterol. Same for inhalers. Inhalers can be very expensive. Those are $7 if you're on a brand name. So just very, very valuable to people as they're trying to afford their medications. And it pays the premium for a Part D plan. And no deductible, no copay, no donut hole, right? So also really good benefit there. And it gives you a one-time opportunity during a year to change your drug plan. So say you're diagnosed with something new, it's not on that formulary, you have an opportunity to change your drug plan during the year and get onto a plan that does cover that. Senior Gold, talked a little bit about this one, not as generous a benefit, but the income limits are higher, $10,000 higher than the PAD program. Again, just an income eligibility. We worked through a little bit about how that would work for if you had a copay of $100, the plan would end up costing you around $57. The Senior Gold would end up costing you about $57 with that plan. You must have a Part D plan, a drug plan, in order to use that. And I think that's it. And it does not pay the premium on your drug plan. So it just helps with that out-of-pocket cost at the pharmacy. All right, and the NJ Save application, as I had mentioned, covers all of these plans. It covers the QMB, the SlimB, the PAD, the Senior Gold. It also can get you enrolled in extra help with the prescription costs, or the LIS, and can help with all of that cost sharing depending on what you are eligible for. And if you are, it also screens for assistance with utility bills. So if you qualify for PAD, you also qualify for a $225 credit on your utility bill. And it'll also screen you for, there's two other utility assistance plans in New Jersey, and it will screen you for that. And we just talked a little bit about open enrollment. You can change your drug plan, you can change your Medicare Advantage plan. Starts October 15th, ends on the 7th. And again, that opportunity to change your Medicare Advantage plan January 1 to March 31 if you have somehow enrolled in something that's not going to work for you. How to avoid scams, because you're going to be getting a lot of calls, a lot of mail. Medicare will not call you and ask you for your bank information or your social security number. Keep it under wraps. You can protect your Medicare number, same as you would your credit card. Years ago, your Medicare number was the same as your social security number. Fortunately, they got smart to that and decided to give a different number, but it's still very important for you to keep that confidential. And Medicare will not send representatives to your home. If they're people that are trying to come to your home, they're insurance agents that are trying to sell you healthcare policies. Again, another benefit of SHIP counseling, we are not trying to sell you anything. We provide you the information of how to enroll. A lot of times you can call Medicare and enroll in these various plans, not the Medigaps, because those are private insurance companies, but if you identify a drug plan you're interested in enrolling in, you can either call the drug plan itself, we give you the telephone numbers, or you can call Medicare and say, hey, I want to enroll in this plan. Same for Medicare Advantage. You can enroll through Medicare, the 800 number. You can enroll by calling the plan, or you can enroll even online. And we're funded, the SHIP program is funded by the Administration for Community Living in partnership with Medicare and CMS. We're free. I forgot to mention that. I think maybe first up I did, but free counseling, information on Medicare plans and choices, help for problems with claims or enrollment, because those things come up, especially with claims. Issues can come up during the course of the year, so we're there for you. Our counselors are trained, and trained. Especially as, with COVID, more training has become available online. And so the opportunities for additional training have been extensive. And we always do a fall and a spring training also. So they are trained. Again, we do not sell anything. We are just helping you to find the insurance coverage that's going to fit your needs and how you want to approach your health care. And 732-728-1331 is how you get us. Thank you.
Thank you, Janet, on behalf of the library. There's a lot of very valuable information. Thank you for presenting it to us today.
Thank you. Thank you very much.
You're
Thanks for having
welcome.
me.